My name's Julie Wilmot. I'm the Nurse Manager of the ICU here at the Alfreds Hospital in Melbourne. My role is to manage the intensive care unit. We have 270 permanent staff. An average day would be arriving at work between 7:30 and 8 o'clock in the morning, meeting with staff, any issues from overnight, finding out where everyone's at, normal meetings throughout the organisation, assisting with operations. We very much work as a team. I don't think there's any one individual, including myself, that can say, I manage the ICU. We do it together. Often being involved in a situation where a patient has passed away is a very humbling experience, and that's how I describe it to them. Even though it's very sad, it's very humbling for them, and to be a part of that with the family I think is quite amazing. Whilst the nurse doesn't necessarily break the news, they are part of the conversation with the family at all times, and if they know what is going to happen with the patient, they certainly do not say everything's going to be okay. They're realistic and they talk through that maybe things aren't going to be okay. Our mortality rate's only about 6%. It's not large, so every time someone does pass away, it is a unique experience for that nurse and that family. The staff do debrief together. If something's bigger, we organise a more formal debriefing for them to have some structure around it, so that they're not just talking and drinking beers, which is nice at the time, but sometimes that doesn't resolve the issue for the staff member. So certainly what we will do is then organise something else. Although sometimes, most of the time, the staff will debrief with one another at the time, and we organise a formal debriefing, and we might get 2 people come to that, but that's beneficial for those 2 people. When you do your nursing training, you don't have a lot of exposure to this type of thing, and you're certainly not sort of trained in how to deal with this situation with family. And so I think it's really important that they talk it through with other people so that they can know that the way they've gone about it is appropriate. And often they've had a big cry with the family as well. And I think that's really important, and I always support that with them, because if they feel like that, the family can see that they're human and they're touched by the experience. Whilst we see death, it's not every day in every patient. We see a lot of our patients get better and leave the intensive care unit, and it's very heartwarming, and it's fantastic. We have families come back and visit the staff, and maybe 12 months down the track they come back asking to see the staff members, to say thank you, and just what an amazing time it was for them with the nursing staff in the unit. There's not anything I don't like. I go to Lorne every weekend, so what I struggle with is getting up very early on a Monday morning, driving back from Lorne along the Great Ocean Road. I must say, that's the bit I don't like, but that's life. If that's all the bit I don't like, I think I'm doing pretty well.